non-wound care specialists or healthcare providers to have a look at these at your series, because it's really interesting. Amputation were known during that time. We had bad memory if we come to wound care during the Roman Empire with Napoleon Bonaparte when they were trying to invade Europe. Just want to highlight that during the Arab era or Islamic era, there was a big evolution. There was more evidence base here. So we move on forward and we go to the Egyptian or pharaohs. And as you can see here from the scripts that they found in the pyramids and in archaeology, they found a lot of evidences that they had a knowledge about science, a knowledge about medicine. And don't forget, one of the living evidence is basically the mummies, the way how you preserve the human body. It was and still a mystery, although we uncovered part of it, but it's still a lot of it which is still unknown. How these people during that age they were able to do these things. So we know that they were pioneer in chemistry, because they had a lot of things, alchemy it used to call during that time. Yes. They used to use a lot of these mixtures of elements, chemical elements, to create things from it. Yes. But also they had diseases. So in the left top picture, you can see here a prothesis. So that actually tells you that amputation were known during that time, which means there was diabetes during that time. So there was diabetes, there was failure in treating it, or they were able to manage to do it. But the interesting thing basically here is basically the need of amputation to stop the infection. Okay, and
they were able to diagnose this condition, and that this treatment it's must, and they amputate this living with the lived person, still while he's already alive, they amputate his leg, right, in this way.
Yes, exactly. Now
we feel proud in this area in the Middle East about this advances in the medicine of Pharaonic civilization at that time.
Exactly.
Interesting.
And a lot of the Muslim during the Muslim era and the Arab period, actually, in medicine, where the Arab were pioneer, and Muslims in particular, they were pioneer in this period, where medicine was with a lot of exploration and a lot of knowledge that the Western medicine based their new medicine or new methodologies on it. So it was the base. So all these were the base for what we call now the modern medicine. It evolved. It just evolved. Of course, during that time, the pharaohs, they didn't have the diagnostic tools, but they were able to identify some diseases and management of these diseases. And as we can see, as we say here, we're seeing here in the picture, also they cared about the well-being of the patient. So a patient with amputation, they created for him a prothesis. And that's something very interesting, that sometimes even now in our modern medicine, we fail to get the patient compliant in order to use offloading devices. Which is a critical issue in management. And we will talk about different things when we talk especially in pressure ulcer and the need of these offloading devices and their importance in the healing or management of pressure ulcers. Hippocrates, we know that he is the father of medicine. We know that the oath of Hippocrates for physicians, we consider him as a father of medicine. Okay, he had, and his student, of course, they had a big mark in the creation or the evolution of medicine. But unfortunately, he was the enemy of wound care. We consider him the enemy because his theory was imposed. So during Hippocrates' time, they believed in the pus theory. So they said, any wound to heal, it has to be infected. So there should be pus in the wound. If the wound doesn't go into pus formation, it cannot heal. And they considered that any practitioner during that time, because they were not called doctors, they called medical practitioners, any person who did not believe or follow this instruction, they were not allowed to practice. So there was a mislead, and that's why a lot of people suffered from this theory that led to a lot of complications, deaths, amputations, and so on and so on. So yeah, we had bad memory. If it come to wound care, Hippocrates was not the right person. An interesting doctor, actually, Dr. Galen, Claudius Galen, during the Roman Empire. This was actually the shift in wound care theories from pustulation or allowing the wound to get into the pus into management of wound. And it came by necessity. So during that time, if you remember, there was a lot of wars. So the use of sword and the need for brave soldiers was highly required. If conquering requires people during that time, there was no guns, there were no missiles. So it's about the sword and about the strength. So that's why you needed every person to be on the ground. You needed your heroes to be always. So they are human. They will get injured. They will get cuts, but they couldn't wait until the wound get infected, then heal. They needed them back. Same thing if we know from this picture taken from the movie Gladiator, it's during that time it was considered a sports when you have people killing each other, and it's about teams. And again here you had heroes and people who were like very strong that you need them to be on your team to win. It's a bad of course habit, but that was their their style of living. Now what happened is that doctor that physician or a practitioner, he was thinking how to get these people back very fast. So he said, why don't we try to close the wound directly? So whenever the soldier or the gladiator got cut, they directly burned the wound with hot metal or with hot oil. And they have seen that these wounds, because they are acute wounds, and you're putting thermal factor here. So you are killing even the bacteria inside the open wound. So that's why you are translating a wound from a contaminated wound into almost a sterile wound because of the high temperature that they are putting through the metal or through the oil. And of course you are causing a wound closure. So a lot of these wounds they cut.
Yeah, I think this will be also interested to know more, as there are so many focus on this issue in the history series or history movies that they come, even many of the history series they make to hit the sore or something. But because this was the normal practice at that time, for us here, isn't they are doing a burn for the gladiators or for the patient, and then the patient will suffer from the burn itself? Or how do you see this point, Dr. Hussam?
You mean in our time or in their time?
In their time, they are converting the wound to be burn now, right?
Yeah. Well, don't forget when they are dealing with burn, especially when the wound is deep and they are burning it, they are in a way or another like closing the internal layers of the skin, and even the muscles. because it go deep sometimes to reach the bone. And here, actually, when you are putting heat, you are doing coagulation. You are creating, as you have mentioned, a burn zone. Okay, but don't forget, you don't have an open access to the bacteria to go inside the body.
Then
so that minimizes the risk of infection. Exactly.
It's
now, regarding burn, during that time, exactly. So the entry point of the bacteria was not there, and you are ending up with a superficial wound. Okay. Now they cannot see what's inside, and of course it will take time. But we are talking about people who are not an aged people. Yeah, we are mainly talking about soldiers and gladiators that they are in their 20s, 30s, maybe 40s, so they're still young. So they most probably, I mean, of course they were failure, but there is high chance of success, because these people, they didn't have chronic diseases during that time. It was not that common, like the diabetes, to say that the healing process will be delayed. So basically, the healing process will take place, and the wound or the burn will get treated in the end. Of course, there is still a chance of, if wound is big and the burn, of course, is you are causing here a damage to a huge surface area, the failure rate, of course, increased. But all in all, it was more in favor. So there were more benefit from it than having just waiting the wound to be infected and healed by itself. So they found a better results. That's why it became more as a practice, specifically for acute wound. For chronic wounds, there's nothing mentioned during that time how they dealt. Like, you remember, during that time, there's a lot of skin diseases, plague, and all these things. Of course, the burning didn't work during that time. So they used to use other kinds of remedies that, of course, I doubt it worked, because of the, like the plague by itself, it took a lot of people away. And there was, it's only, they think about the Black Ages during that time. So there was no cure for that, for that disease during that time. So chronic wounds or chronic diseases of skin, it was not much reported that they have any kind of successes using these things. So this was mainly to manage acute wounds. Now, after that, actually, there was more and more evolution, and that's coming from France. Dr. Paré, he was among the French Crusades, actually, when they were with Napoleon Bonaparte, when they were trying to invade Europe. And again, he found something that benefited the evolution of wounds. So for that doctor, he was, as you know, a doctor, a medical doctor in the army. One of their major responsibilities is, after every battle, to sort the wounded soldiers, okay, into soldiers who had minor damages or major cuts or major wounds, and there's chance for healing them, and these who have been really exposed to a lot of wounds, or there was a damages to a great surface areas that could lead to or possibility for the healing is not that high. So the sorting, this is one thing that we benefit from Dr. Paré. Another thing here is basically, when they sorted these wounded soldiers, they segregated them. So that as we mentioned, the soldier that there is a hope to heal them, they put them close to the campfire to keep them warm, to take care of them directly. And the patient, or the soldiers who had less chance of being healed, they kept them away just because there was no space, and they didn't give them much attention, because they needed as fast as possible to help these I would say, well, let's say there's hope in these soldiers to get them back into the field as soon as possible, because they need them in the field, back in the field. So that's why they give them more attention. What he noticed is basically that the wounds of the soldiers who were away from the camp in the cold, they didn't get infected. Their condition didn't deteriorate as fast as the soldier who had even smaller wounds. These patients, the soldiers were closer to the fire. They developed a more fast process of infection. So he understood that cold really delays the healing process, but also delays the infection and the deterioration of the wound. So he started using cold in treating wounds. So, but nevertheless, he didn't have other ideas. As you can see, one of his very interesting statement, he said, "I made the wound, God heals it." Who basically, when he opened the wound, he take out the bullet from inside the body, but after that, he just burned it, okay? But he has no other control. That's why his words just really reflects what he was suffering from. So he was able to get the bullets out, whatever get into the body out, but after that, he just asked God to help in getting the wound healed and the soldier back on his feet.
And I think this is also interesting, Dr. Hussam, as in some time until now, until these days, still the wound care process, still something we are discovering, and we still belongs that it's a matter of God at the end, or God gift to the people, as there are so many unclarities still in the process of wound healing. What do you think?
Exactly, Dr. Abdul Karim. I mean, when we will reach a little bit to the new era, or the advent or the evidence-based era in wound care, we will see that day after day we are still discovering more and more things that we didn't know. More and more. I mean, it is an opening in the body, but it differs. Up till now, we still have wounds that we do all what we know, or we put all our knowledge and our experience in it, and nevertheless we are failing to heal it, because there's a lot of things behind wounds. Yeah, and it's not about cut like in the old time. Now we are talking about a lot of these comorbidities that has a major impact, and the pressure ulcer is one of really a very interesting topics that's not highlighted a lot in our era up till now, despite the fact that it's one of the leading skin disease. Yeah, and thank you very much for highlighting this and making this series that could really lighten the way for a lot of wound care, of practitioners, and hopefully not only wound care, but also I hope that non-wound care specialists or healthcare providers to have a look at these at your series, because it's really interesting what you are highlighting. These things that we cannot find easily, we are getting all our experience and we are putting it in smaller presentations. So hopefully everyone will benefit from this.
Thank you for being with us also, Dr. Hussam. Interesting. Yes.
Yeah, it is always my pleasure, Dr. Al-Karim. So the Arab era, we talked a lot about it. We just want to highlight that during the Arab era or the Islamic era, there was a big evolution. There was more evidence base here, because and Ibn Sina and Al-Razi, so in medicine and pharmacology, there is a lot of, as I said, of methodologies that being reported and documented that were the foundation of the new medical era. Also the surgeries started during that time. So they started to do surgeries, and it's very well common practice. So there was surgeons during that time. There was evolution in ecology, understanding where to build where is the best place to build a hospital on, like in Iraq. What they did, especially in Baghdad during the time, is basically where to build the hospital. One of the methods that been documented is they took cuts of meat and they spread it in different areas and different regions in the city. and the area where the meat get rotten the least. So that the last piece that got rotten is the area where it has the best ecological elements there, and this is where they build their hospitals. So you can see that there was a lot of emphasis on science during that time, and not just on methods and trial and error. Of course, there are still trial and error, but they had some kind of a practice, and that's what we have still up till now documented. Unfortunately, despite that, there was a lot of the damages to a lot of these books that were written when conquers and wars took place, and they burned a lot of these references. But nevertheless, some of them survived and became the base of medicine. Don't forget, during that time, during the Arab era or the Islamic era, Europe was in its they call it the dark ages, where myth and magic was the base of many things, including medicine. And the people who were, or they were part of the Crusades, they took a lot of knowledge with them and a lot of these books, and they took it back to Europe, and it helps in evolution and to what we have now all over the world in medicine.